Sad.
Tired. Empty most of the day.
Sluggish.
You're feeling uninterested most of the day, almost every day.
Can't sleep.
Can't sleep.
I can't sleep. Most of the day. Almost every day.
Sleep too much.
Sleep too much. Feeling worthless.
And hello once again. Welcome to another roundtable session. I am Mr. Faust, one of the hosts or moderators, and we have the Children's Guild here. We have Miss Cook, and we have Miss Shade, and we have Miss Maria as well. And our topic of discussion for this month will be depression. I want to thank y'all once again for just allowing us to have the opportunity to talk about different topics that are important. But I do feel like that depression might be one that might be a sensitive subject as of late, even with the idea of us having less interactions. So once again, I want to thank you all for being able to share and give us insight on those things. So I just want to go ahead and get started. Can we relate a little bit, see the difference between the idea of sadness and depression? Can somebody give me a little bit of information about, is there a difference between the two?
Yeah, so there definitely is because, everyone experiences sadness at some point in their lives, right? You can even have, you could be sad because a turtle died, your pet turtle or whatever it is. You can be sad because you didn't get something you wanted for Christmas, right? So there's these different feelings that you have when you're sad, whereas, depression is more of a state of being. Like you don't have a rhyme or reason for being sad necessarily. It's just there. And it can be debilitating, right? Whereas sadness, it's like, oh, let me call a friend and I can cheer myself up, right? With depression, a lot of times, like that cheering up is really hard to do. And like I said, everyone experiences sadness from time to time, but not everybody experiences depression.
I know another thing that, I was trained since I am a therapist, is if it impacts our functioning in day-to-day lives. So if you notice that, like, oh, I feel sad today, but then the next day you're kind of back to your normal baseline, versus someone who's experiencing depression where they're not, attending classes anymore, turning in their work, or even they don't feel like talking to their friends or parents or anyone that they're close with. Anything where it impacts like daily functioning is also a really big dividing factor of what's sadness and what's depression.
Right. And so I think it's good to kind of clarify because depression is a mood disorder, right? Whereas sadness is not. And so like Miss Bonella was saying, it's a persistent feeling of sadness and loss of interest of things most of the day, nearly every day, right? So sadness is like a temporary thing if you think about it, whereas depression is almost every day, nearly all day. You know, things that once brought you joy you don't want to do. You may have reoccurring thoughts of dying or suicidal ideations is what we like to say. So it's really that thought of like, I could die and I don't care. Or just having those thoughts of suicide and actually having a plan. That goes into it as well. Feelings of worthlessness, feelings of irritability, feeling hopeless and constantly tired but sleeping all day is another one. Or you can have what is it? Hypersomnia? I can't remember the actual term. But that's when you're sleeping all the time, right? So insomnia would be I'm not sleeping at all.
Right.
And then the hyper would be I'm sleeping all the time, but I'm still tired.
Yeah, and these symptoms related to sleep as well as eating, either sleeping too much or sleeping too little, and eating too much or eating too little, like really, really rapid weight gain or really rapid weight loss, can also be symptoms of depression.
But we also want to, because we work with teenagers, I think we have, that's a touchy one, right? Because
That's
a lot
true.
of kids are playing sports or their hormones are kind of out of balance. And so, like, I know when I was younger in high school, I ate like a grown man because
Mhm.
I played sports year round. And so, I would eat a full meal and then have dessert and then have another full meal at dinner.
Mhm.
So, I think you have to kind of be able to separate those things out and
I
say,
think
okay,
that's
is
true.
this normal teen development because you're doing these extra things, or like Miss Shade was saying, is this more of I'm sad, I'm eating because I'm sad, or I'm not eating because I'm sad?
So those ideas, those are the symptoms and signs that we have for clinical depression. Is erraticness like not having routine self, going in and out of cycles, or just
It
is that a part of a clinical depression,
It
or
can,
would that be a
depending
sign?
on what it is.
Okay.
As if you're talking about sleep, it can be. But, it really would be an individual thing. Like,
Okay.
and that's
All right.
what I do want everyone to realize, that even if you have these symptoms, it doesn't mean that you're going to be diagnosed with depression, because there's a lot more that goes into a diagnosis than just saying I have, sleep apnea, or not sleep apnea, but, I don't sleep well, or I'm overeating. We can actually log on and Google anything and we're going to be diagnosed with something,
All right.
right? But that's not how it really works. And I think it's important for kids to know that, going to a therapist or a psychiatrist, those are the people that, like us, are the people that can diagnose it or say, nope, you have normal teen behaviors.
Right.
Yeah. But so there are a few extra symptoms for clinical depression. Um, we mentioned the feeling sad or hopeless, um, lack of interest in doing things, abnormal weight loss or weight gain, increased or decreased appetite. But again, it depends. If they're playing sports, they need that energy. They need to
Mhm.
eat those things. Can't sleep or you sleep too much. Change in body movements. So, like, if somebody notices that you're like sluggish or you're moving just really slowly, like that could be a sign of depression as well. Being constantly tired, feeling worthless. Poor concentration is another one. And so sometimes we think of it as, oh, well, this kid can't concentrate. He has ADHD,
Mhm.
right?
Yeah.
It might not actually be ADHD. It might be that they're so depressed they can't think clearly, right? Or there's nothing in their heads. Like they're just, I can't focus on anything. It's not that I can't focus on your class. It's I don't focus on anything, right? And then the last one, of course, is the recurrent thoughts of dying, or feeling that you would be better off dead.
Mhm. So in all of this, the idea of effective productivity and just relationships, how can clinical depression affect productivity, as you were just saying, and even the idea of the relationships you have with your peers, your family, your friends, and things like that?
Yeah, so I think it's again, it's by person, right? So there are people that have depression who excel, who get straight A's, who, you would look at them and go, "Wait, what? Like, what do you mean you have depression? Like, you've got it all. You're gorgeous, you're getting straight A's, and, you don't seem like you're sad at any time, right?"
Right.
So we can mask it. It's very easy for some people to mask, and then other people it's not. If you're irritable and snapping at your friends and family, that's a good sign that somebody might have depression. Because a lot of times when people are sad, they project. And so they're gonna, put it out there as like, and we often say, like, you're blaming other people for your problems, right? Like, it's your fault. It's not mine. It's your fault. You should have done this for me, or, just different things like that. So that can affect your relationships a lot. And some kids that have depression have a hard time making and keeping friends, because they're afraid to either open up and be themselves. And so they don't want the other people to know that they have these feelings. And so that's really hard. Sometimes, as adults, it can be so debilitating that they can't work. And so they end up getting disability because of their illness. And I think it's important to note that it is an illness. It's not, somebody has actually called it a disease, right? And it should be treated as, a cancer or anything else that's medically treated. Yeah.
So, can we identify some risk factors or anything that they may have while when we're dealing with depression?
Sure. So the National Institute of Mental Health lists 5 different risk factors for depression. One is a personal or family history of depression. So if you've experienced extreme sadness, right, which is what we're talking about here, on a reoccurring basis for a long period of time, or if a parent has had depression or grandparents have had depression, that is a risk factor for you individually having depression. Major life changes. We're talking about, COVID. I mean, that's a huge risk factor, right? Like we're taking kids away from their social environments. And, even for us adults, we were just talking about it before this meeting, the pandemic fatigue, right? We all want to do stuff. We're getting to that point where it's like, I miss going out with my friends. I miss seeing people. And even us introverts like me, I want to go out and do stuff. I'm like, I love being at home, but like, let me get out there. So that's a risk factor. If you're moving a whole lot, a lot of times when kids move from school to school to school or from neighborhood to neighborhood to neighborhood, and you don't have that consistency of being in a stable one area, that can be a risk factor as well. Trauma, chronic stress, and certain physical illnesses and medications can also be risk factors. And chronic stress, we talk about that can kind of go in with those changes in life that are consistent, right? Like you're chronically under stress. So like over a period of time, like through the years that you're through your growth and development, you're just experiencing so much stress, and that can be a risk factor for that depression as well.
All right, and this question is for everybody. How can individuals, whether they're teenagers or adults, how can they cope with the feelings that they may be having during depression?
So I think, first of all, it's really important to reach out to someone that you trust in your life and tell them that you're having these feelings, whether that's a parent or if you already see a therapist, your therapist, some kind of person who you see in your life who can help you out. And I think trying to see a therapist about these feelings is also really, really important because they can help you figure out how to cope with them and how to find effective strategies.
Mm-hmm.
Yeah, just kind of going off what Ms. Shade was saying is please reach out to somebody. You are not the only one dealing with this. And it may feel as if you're alone and that no one can possibly understand, but that is the illness talking to you, trying to keep you in that space. You are not alone. There are thousands, if not hundreds of thousands of people who deal with this on a daily basis, and they've gotten better because they've reached out. So I think that's possibly the best option if you're having any of these feelings or even think that you might be experiencing clinical depression, is just reaching out and just asking the questions and gaining more knowledge about it.
Something else that I think is great is calling Maryland 211. It's a resource with United Way, and if you dial 211, you can press 1 and get someone to talk to any time of day, which is great because we at the Children's Guild, we have, the kids that work with us, we have an on-call supervisor that they can reach, but the number is like so long, they have to press this and that and the other. The calling 211 is a good way to kind of go as well because there is somebody to help and it's an easy, quick quick number. I would also say for the kids in our school, reach out to Miss Bell, Miss Withrow, Miss Ganley, Miss Roberts, a teacher that you like. Just reach out to someone at school. On your own, exercise, eating healthy. Those are things that can help. I know I was thinking we should have gotten Miss Ballantyne in here because she teaches that psychology class. And, I know they talk about serotonin and dopamine levels, right? So serotonin is you're like, I feel really good, right? And the dopamine is like, woohoo, I haven't seen you in so long. I'm so excited, right? So we need that. And for teenage girls, they have very low serotonin and dopamine. So doing things that will increase that is really helpful to balance out those feelings. So exercising, eating healthy food, getting enough rest, setting realistic and goals and expectations for yourself is another one. Spending time with friends. Allow other people to help you. That's a huge one, because there are people like us who are out here. We're here, and that's our job, is to help you, and we want to help you. It's more than just a paycheck to us. We really care. I don't know a single therapist that goes into therapy that does not care. And believe me, the money's not that great. So
Same thing for teachers.
Yeah. And so the other things too are to curb your impulsive behaviors and decisions until you're feeling better. Because a lot of times it's like, oh, my boyfriend broke up with me or my girlfriend broke up with me. My life is over. It's not over, right? Like we have in our teenage brain, it's really hard to focus on the future and focus on things outside of what's going on right now. And that's normal, right? It's normal growth and development, but it's helpful for the kids to realize like this isn't going to last forever. This is just momentary. And to talk about it is really good. So educate yourself on the symptoms and recognize when they're happening and reaching out for help. That's really the best things that people can do. And so with therapy, as Miss Bonello was talking about and Miss Shade, we are the Children's Guild. Bay Life Services is also at Chesapeake High School. So we have a couple of different avenues that the kids can go. But CBT, which is a way to get you to think differently about things and to change your behavior, that works. There's also solution-focused therapy that works really well for people with depression. And then sometimes medication is necessary. And so, a referral to psychiatry would be a possibility depending on the severity of the depression.
Just for a side note, if you are a friend or you have a family member that might be going through depression, can y'all give any advice on like how they should try to care for anyone who might be having clinical depression at the time or about?
Yeah, I mean, I think the worst thing that somebody can say is you shouldn't be sad,
Right,
right?
yeah.
So I
That's
think
what you want them to, like, you want to get them out, but like, yeah, us knowing how to relate to that usually is the problem, I think, for
right. And
people who want to get them out of it.
exactly. And I think just sometimes sitting in the same space is helpful and just being quiet and listening. And if they're not talking, they're not ready to talk about it, and just let them be quiet, but know that they're supported. And I think that's the biggest thing. And you can actually say to them, like, I know that something's going on, and when you're ready to talk to me, please do, so that they know that they have somebody to go to that they can trust.
Right. Well, once again, I definitely thank y'all once again for Children's Guild. You give so much great information for our students, and it's very enlightening, just even for me as a teacher, just even knowing how to look at symptoms and how to, even be able to cope if there's a bout of depression even comes even as an adult. So once again, I definitely thank you. And once again, please reach out to the Children's Guild if you have any questions or concerns. But once again, I thank you all for your time and your effort for putting this together for us and us to be able to have a roundtable. So until next time, I thank y'all and have a great day.
You as well.
Thanks. Bye.